Now that we know more about bladder cancer and how it's staged, let's move on to treatment. What are the goals of treatment for bladder cancer?
So the goals of treatment depend on what stage the disease is in. For patients who have non-muscle invasive bladder cancer, we use the oldest immunotherapy that is out there called the BCG. And the goal is to prevent recurrence and prevent progression to muscle invasion. And many times, despite treatment, that may not happen, and that's when patients need their bladder out. So I would say that the goal for treatment for localized disease is to cure the disease and prevent distant recurrences and prolong survival. And the goals of treatment with metastatic disease are to improve survival and delay progression-free survival, improve response rates.
What do you feel is the patient's role in treatment decisions?
I think patients are the key. We center everything around for treatments, right? There are so many treatment options, and it's really very difficult to make a decision without getting the patient's perspective and what are the patient's goals from their lives and what they see the cancer as. So, for example, if somebody has muscle invasive disease and the cancer is not very big, and the patient has the option of getting the bladder removed, which means they will have a stoma for the rest of their lives, or they can retain their bladder after undergoing the radiation and chemotherapy and still undergo cystoscopies or looking inside the bladder every 3 months. Some patients just don't want a stoma no matter what. So we try to tailor therapies according to that. And many times patients, these are older patients, they may have a lot of comorbidities. They may not be the most fit patients to undergo a big procedure. So we have to tailor it according to the patient. I think the patient's role is what we all strive to go by, because what is a good treatment for one patient may not be a good treatment for another patient.